In 1987, Diana shook hands with an AIDS patient without gloves. No one had ever done that before. The world was shocked. Doctors said, "This is impossible. She'll get infected." But Diana didn't care. That one handshake changed the world. Before we explore this revolutionary moment, please consider subscribing to the Diana Stories and hitting the like button. Your support helps us tell these important stories about Diana's incredible legacy. On April 19, 1987, Princess Diana did something that shocked the world. She opened the first dedicated AIDS ward at London's Middlesex Hospital. But what made headlines around the globe wasn't the official opening ceremony or the speeches. It was a simple gesture. Diana shook hands with an AIDS patient, and she did it without wearing gloves. This might not sound revolutionary today. We now understand how HIV is transmitted. We know that casual contact, like handshakes, hugs, or sharing spaces, doesn't spread the virus. But in 1987, the world was gripped by fear and misinformation about AIDS. Diana's handshake was an act of courage that helped change public perception and saved countless lives. The AIDS crisis in the 1980s. To understand why Diana's gesture was so significant, we need to understand what the world was like in 1987. AIDS had been identified only 6 years earlier, in 1981. By 1987, it was a death sentence. There was no effective treatment. People diagnosed with AIDS knew they would die, often within months or a couple of years. But beyond the medical reality, there was widespread panic and misinformation about AIDS. People believed AIDS could be transmitted through casual contact. They thought you could catch it from toilet seats, drinking fountains, or simply being in the same room as someone with AIDS. Restaurants refused to serve AIDS patients. Landlords evicted them. Employers fired them. AIDS patients were treated as modern-day lepers. They were isolated, shunned, and feared. Many people, even healthcare workers, refused to touch AIDS patients without full protective gear. Families abandoned loved ones who were diagnosed. The stigma was so severe that many people with AIDS died alone, untouched and unloved in their final days. The gay community was hit particularly hard, as AIDS was initially identified primarily among gay men in Western countries. This led to additional stigma and discrimination, with some religious leaders and politicians calling AIDS God's punishment for homosexuality. The fear and hatred directed at AIDS patients was toxic and deadly. In this climate of fear and ignorance, AIDS patients were suffering not just from their disease, but from complete social isolation. They were literally untouchable. Diana's growing awareness. Diana had been aware of the AIDS crisis for some time before 1987. She had seen news coverage of the epidemic. She had read about the suffering of AIDS patients, both from their disease and from society's treatment of them. Diana had a natural empathy for people who were suffering or marginalized. Throughout her time as Princess of Wales, she gravitated toward causes that other royals avoided. She visited homeless shelters, addiction treatment centers, and facilities for people with mental illness. She wasn't afraid of difficult subjects or vulnerable populations. When Diana learned about the isolation and stigma faced by AIDS patients, she wanted to help. She began educating herself about HIV and AIDS, reading medical literature, and speaking with doctors and researchers. She learned the scientific facts about transmission and wanted to use her platform to share that information with the public. Diana also began visiting AIDS patients privately, away from media attention. She would sit with them, talk to them, hold their hands. She saw firsthand how desperately these patients needed human contact and compassion. Many told her they hadn't been touched by another person in weeks or months. Their families were afraid. Healthcare workers kept their distance. Diana's visits brought them comfort and dignity. The Middlesex Hospital visit. The Middlesex Hospital in London was opening the first dedicated HIV/AIDS ward in the UK. This was a significant development, a facility specifically designed to care for AIDS patients with specialized staff and resources. Diana was invited to perform the official opening ceremony. Diana accepted the invitation immediately. She saw this as an opportunity not just to support the hospital, but to make a public statement about AIDS and how we should treat people living with the disease. The palace and Diana's advisors were nervous. AIDS was controversial. Some members of the royal family and government officials thought Diana should avoid the issue. They worried about associating the monarchy with a disease that was so heavily stigmatized and linked to homosexuality and drug use. But Diana was determined. She had made up her mind that she would use this moment to challenge the fear and misinformation surrounding AIDS. She planned to do something no public figure had done before. She would touch AIDS patients without gloves, in full view of the cameras. The moment that changed everything. On April 19, 1987, Diana arrived at Middlesex Hospital. The media was there in force, cameras ready to document the royal visit. Diana toured the new AIDS ward, speaking with staff and learning about the facility. Then came the moment that would make history. Diana entered a patient's room. The patient was a man in his late 20s or early 30s, visibly ill from AIDS. He was thin, weak, and clearly near the end of his life. Diana approached the bed, and then, deliberately and visibly, she removed her gloves. This was the crucial moment. Royal protocol typically required gloves for official handshakes anyway, but everyone knew why this was significant. Diana was making it absolutely clear that she was choosing to touch this AIDS patient's skin to skin. Diana sat down on the edge of the bed. She took the patient's hand in hers. She held it gently, looking at him with warmth and compassion. They spoke quietly. Diana asked how he was feeling. She listened to his responses. She smiled at him. The cameras captured everything. The image of Diana, Princess of Wales, holding the hand of an AIDS patient without gloves, was transmitted around the world. It appeared on front pages of newspapers across the globe. It led television news broadcasts. Everyone saw it. Diana touching an AIDS patient, unafraid, treating him as a human being worthy of compassion and dignity. The immediate reaction. The reaction to Diana's handshake was swift and massive. Some people were shocked and horrified. They genuinely believed Diana had put herself at risk. Letters poured into the palace expressing concern for her safety. Some people criticized her for being reckless or accused her of staging a publicity stunt. But the overwhelming response was positive. Medical professionals praised Diana for using her platform to demonstrate scientific fact. Dr. Jonathan Mann, head of the World Health Organization's AIDS program, called Diana's gesture enormously important in fighting stigma. AIDS activists and advocacy groups were thrilled. Diana had done more in one moment to humanize AIDS patients and challenge stigma than years of their work had accomplished. Her royal status and global fame meant her message reached people who would never have listened to activists or even doctors. Media coverage was extensive and largely supportive. Newspapers ran stories explaining how HIV is actually transmitted, using Diana's visit as a teaching moment. Television programs featured medical experts discussing the facts about AIDS transmission. Diana's handshake became a springboard for widespread public education. Most importantly, AIDS patients themselves felt seen and validated. Diana's gesture told them they weren't untouchable, they weren't disgusting, they were human beings worthy of compassion and dignity. The scientific truth Diana was demonstrating. What Diana was demonstrating with her handshake was simple scientific fact. HIV is not transmitted through casual contact. The virus that causes AIDS spreads through specific bodily fluids: blood, semen, vaginal fluids, and breast milk. It requires direct access to the bloodstream.
HIV cannot pass through intact skin. A handshake, a hug, touching someone's arm or face, none of these activities can transmit HIV. You cannot get HIV from toilet seats, drinking fountains, swimming pools, or sharing food. You cannot get it from mosquito bites or being in the same room as someone with AIDS. Medical professionals had been saying this for years. Research papers had documented it. Public health campaigns tried to spread the message, but fear and misinformation persisted. People didn't believe the experts, or they simply couldn't overcome their visceral fear. When Diana, a beloved public figure, demonstrated these facts through her actions, people paid attention in a way they hadn't for medical professionals. Diana made the scientific truth accessible and believable. If a princess could safely touch an AIDS patient's hand, then clearly the medical community wasn't lying about transmission. Diana understood the power of visual communication. She knew that one photograph of her holding an AIDS patient's hand would do more to educate the public than 1,000 scientific papers. She was right. Diana's continued AIDS activism. The Middlesex Hospital visit wasn't a one-time gesture for Diana. It was the beginning of sustained activism around HIV and HIV that continued throughout the rest of her life. Diana became a patron of numerous AIDS charities, including the National AIDS Trust and the London Lighthouse, a residential and support centre for people living with AIDS. She visited these facilities regularly, often without media attention, spending time with patients and staff. She visited AIDS wards in hospitals across the UK and around the world. She went to pediatric AIDS units, holding babies born with HIV and showing that they too deserved love and care. She met with gay men dying from AIDS, drug users, hemophiliacs who had contracted HIV from contaminated blood products, all populations facing severe stigma. In every visit, Diana's approach was the same. She removed barriers between herself and patients. She would sit on their beds, hold their hands, hug them, kiss their foreheads. She treated AIDS patients exactly as she would treat anyone else, with warmth, respect, and genuine interest in their lives. Diana also used her platform to advocate for better treatment and funding for AIDS research. She gave speeches about the need for compassion and the danger of stigma. She called for governments to invest more in finding effective treatments and eventually a cure. The global impact. Studies conducted in the late 1980s and early 1990s showed decreasing fear of casual contact with AIDS patients. More people understood how HIV actually transmitted. Discrimination against people with AIDS began to decline, though it certainly didn't disappear overnight.
Healthcare improved for AIDS patients as stigma decreased. More hospitals opened dedicated AIDS wards. Healthcare workers became more willing to treat AIDS patients without excessive protective gear. Families felt more comfortable caring for loved ones with AIDS. Funding for AIDS research increased significantly in the years following Diana's activism. While this was due to many factors, Diana's high-profile advocacy helped make AIDS a priority rather than a topic to be avoided. Politicians found it harder to ignore the crisis when a globally beloved figure was speaking about it. Diana's impact was particularly significant in the gay community. Her compassionate treatment of gay men with AIDS at a time when they faced severe discrimination was deeply meaningful. Diana became a beloved figure in the LGBTQ+ community, remembered as an ally who showed up when others turned away. Internationally, Diana's influence extended beyond the UK. Her visits to AIDS facilities in other countries helped challenge stigma globally. In countries where AIDS was even more heavily stigmatized than in Britain, Diana's example gave local activists and healthcare workers a powerful tool for education and advocacy. The personal cost. Diana's AIDS activism wasn't without personal cost. Some members of the royal family disapproved of her focus on AIDS. They felt it was too controversial, too closely associated with homosexuality and drug use. They worried it would damage the monarchy's image. Diana faced criticism from conservative groups who accused her of promoting immorality by showing compassion to people whose lifestyles they condemned. She received hate mail from people who thought AIDS patients deserved their suffering. Some of Diana's friendships within royal and aristocratic circles became strained. Not everyone understood why Diana was wasting time on AIDS patients when there were so many other worthy causes she could champion. But Diana didn't waver. She believed this work was important and that her unique platform gave her both the opportunity and the responsibility to challenge stigma and show compassion. The Middlesex Hospital patient. The specific AIDS patient Diana was photographed with at Middlesex Hospital that day has remained anonymous. This was deliberate. Diana and the hospital protected his identity to preserve his privacy and dignity. We don't know his name or his specific story. We don't know if he had family or how long he lived after Diana's visit. But we know that in his final days or months, he received compassion and human touch from a princess, and that his role in that historic moment helped countless other people.
The anonymity is perhaps fitting. Diana's gesture wasn't about one specific person, it was about all people living with AIDS. That patient represented everyone facing the disease and the stigma surrounding it. Medical professionals working in HIV/AIDS care have consistently credited Diana with dramatically improving their ability to provide care and conduct research. Before Diana's activism, healthcare workers struggled against public fear and political neglect. After Diana brought attention to AIDS and demonstrated safe interaction with patients, funding increased, stigma decreased, and healthcare workers found their work valued rather than feared. Nurses and doctors who had been treating AIDS patients in isolation suddenly found themselves supported. Research scientists also benefited from Diana's advocacy. With increased public awareness and decreased stigma, recruiting research participants became easier. Funding for research expanded. The development of effective treatments accelerated, though it would still take years before truly life-saving medications became available. Dr. Margaret J., who worked with Diana on AIDS issues, later said, "Diana's contribution to changing public attitudes about HIV/AIDS cannot be overstated. She used her position to challenge fear with compassion and misinformation with truth." The modern perspective. Today, HIV/AIDS is a manageable chronic condition rather than a death sentence, thanks to antiretroviral therapy. People with HIV who receive proper treatment can live normal lifespans and cannot transmit the virus. This medical progress is the result of decades of research and advocacy. But we haven't completely eliminated AIDS stigma. People living with HIV still face discrimination in some contexts. Misinformation still exists. The work Diana helped start continues today. Diana's AIDS activism is remembered as groundbreaking. The photograph of her holding an AIDS patient's hand is iconic, reproduced in textbooks and documentaries about both Diana's life and the history of the AIDS epidemic. William and Harry have both honored their mother's legacy by continuing AIDS advocacy work. They've visited AIDS facilities, supported AIDS charities, and spoken publicly about the importance of compassion and ending stigma. They credit their mother with teaching them to see people's humanity rather than their diagnosis. Why it mattered. Diana's handshake with an AIDS patient mattered because it challenged fear with visible courage. In a moment when people were literally untouchable due to stigma and misinformation, Diana touched them publicly and lovingly. She demonstrated that compassion doesn't require perfect safety, that sometimes the right thing to do involves overcoming fear, and that people facing death deserve dignity and human connection. Diana understood that sometimes one gesture, one moment, one photograph can communicate truth more effectively than volumes of scientific literature. She used her platform strategically and courageously. Conclusion. On April 19, 1987, Princess Diana removed her gloves and took the hand of an AIDS patient. That simple gesture rippled across the world, changing attitudes, challenging stigma, and ultimately saving lives. Diana showed that seeing people's humanity matters more than fear. She demonstrated that compassion is powerful, and that sometimes the most revolutionary act is simply treating people as people.
The AIDS patient whose hand Diana held that day was not saved by her touch. He likely died within weeks or months, as most AIDS patients did in 1987. But Diana's touch reached far beyond that one person. It reached millions of people living with AIDS who suddenly felt less alone, less rejected, less untouchable. And it reached millions more who saw that photograph and learned an important lesson. Fear and stigma hurt people, while compassion and truth heal them. Diana's AIDS handshake is remembered as one of the most important moments of her public life. It exemplified what made Diana special: her willingness to use her privilege and platform to challenge injustice, her genuine compassion for suffering people, and her courage to do what was right, even when it was controversial. That one handshake changed the world, and decades later, it still reminds us of the power of simple human kindness to challenge fear and transform society.